Hi and welcome. First, I want to thank you for taking a moment to watch this video on autoimmune disorder management. If you're here, there's a good chance you've been living with symptoms that feel unpredictable, exhausting, overwhelming, symptoms that can affect nearly every part of your life. And for many people, autoimmune dysfunction shows up as chronic fatigue that never fully improves, joint or muscle discomfort, brain fog, poor concentration, digestive issues and food sensitivities, hormonal imbalance, skin flare ups, weight changes that don't make sense, inflammation that seems to come and go without warning. And perhaps the most frustrating part is this: you may have been told your labs are normal, yet you still don't feel like yourself. In my video, I want to share how my proprietary regenerative cellular healing program is helping individuals with autoimmune related conditions regain stability, reduce flare ups, and start functioning like themselves again. Some of the improvements that patients often experience are reduced inflammation and fewer immune flare ups, better daily energy and resilience, clearer thinking and improved focus, less stiffness and discomfort, improved digestion and food tolerance, better sleep and faster recovery, a stronger sense of control over their health. And many people tell us the biggest change is this: they finally feel like their body is working with them again, not against them. My name is Dr. Anderson. I'm the founder and chief clinician of Premier Health of Summit. It's one of the tri-state area's leading centers for complex inflammatory, neurological, and chronic immune-related conditions. I developed this program through years of clinical experience, and I've been helping patients with chronic autoimmune dysfunction and inflammatory illness since 2007. I earned my undergraduate degree from Boston College and later completed my doctorate at Parker University in Dallas, Texas. And you may have seen my work featured on CBS Morning News or in publications such as the New Jersey Star-Ledger. I'm also the author of this book, Health Within Your Reach. It outlines a natural, non-surgical approach to restoring your health from the inside out. And most autoimmune conditions are managed through traditional methods: steroids, immune suppressing drugs, anti-inflammatory medications, pain meds, symptom control prescriptions. And while these may temporarily reduce symptoms, they often do not answer the deeper question: why is the immune system attacking the body in the first place? Because autoimmune dysfunction is not just a diagnosis, it's a breakdown in regulation, and it involves cellular inflammation, immune system confusion, nervous system stress, gut immune imbalance, metabolic dysfunction, poor energy production inside the cells. So if the body is stuck in an inflammatory survival state, simply suppressing symptoms will never fully restore health. And I hear it constantly from patients: I'm exhausted no matter what I do. My body feels inflamed all the time. I don't recognize myself anymore. I keep getting worse, but no one has answers. Autoimmune dysfunction is complex, and symptom-based care alone is rarely enough. Autoimmune disorders are often the result of multiple systems breaking down over time. And unfortunately, many people are told it's just genetics or you'll be on medication forever. There's nothing else you can do. But that is simply not the full story. Most patients have never received a proper evaluation of what is driving their immune dysfunction. And there is no one-size-fits-all autoimmune protocol. In my clinic, we focus on identifying what is overstimulating or dysregulating the immune system in your body. So we use advanced neurological, metabolic, and inflammatory testing to determine what is actually happening beneath the surface, because autoimmune symptoms are often driven by things like gut permeability and immune activation, thyroid and hormonal dysfunction, blood sugar instability, hidden nutrient deficiencies, chronic infections or viral triggers, toxic burden and detox overload, nervous system imbalance, structural stress affecting brain-body communication. And many patients also have histories involving chronic stress or trauma, mold or Lyme exposure, long-term digestive dysfunction, major medical events, and years of unresolved inflammation. And autoimmune disease is rarely the beginning of the problem. It's often the final stage of dysfunction building for years. So the goal is immune regulation, not suppression. So my regenerative cellular healing program is designed to support the body's ability to restore the balance through calming and overactive immune response, supporting nervous system regulation, improving cellular energy and repair, reducing inflammatory burden, restoring proper brain-body communication, strengthening resilience and recovery. And we do this without relying on dangerous long-term drug dependency, injections, or invasive procedures. So the question becomes, can this program help you? Well, I offer a simple first step, a complimentary discovery call with me where I can learn more about your health history and determine whether it makes sense for you to come in for a full evaluation. During that process, you'll discover whether you're a candidate for this program, what's driving your autoimmune flare-ups, why your symptoms may be progressing, how advanced testing determines treatability, simple changes that may reduce immune overload, and whether this approach can realistically help you regain control, because not everyone qualifies. Some cases have progressed too far, and if that's the case, I will honestly tell you, we see 30 to 40 new patient consultations each month, but due to personalized nature of this work, we only accept a limited number of cases into active care. Autoimmune symptoms rarely stay the same. Without proper intervention, flare-ups can become more frequent, fatigue deepens, inflammation spreads, and quality of life shrinks. It affects your family, your confidence, your ability to travel, work, exercise, and just enjoy life. And I hear it all the time. Doctor, I wish I had found you sooner. The earlier we can identify what's driving the immune dysfunction, the better the outcome tends to be. So call my office today, 908-219-4334. Schedule your discovery call with me. It's complimentary. I'll speak with you personally. Thank you for your time, and I look forward to helping you move toward a healthier, more stable life, free from the constant uncertainty of autoimmune illness. Have a great one.